Dr. Ghatan, the thing I want to talk to you about now is about people who sweat in the underarms, and what can be done there to eliminate that? But because that can be, and it's just must have something to do with the skin, but maybe not. And it's a problem. It's a problem. It doesn't look good, and yet you don't want to put a jacket on it. And no matter what you do, after you sweat for a while, it will turn into smell, because that's what sweat does. It collects all those bacteria. Is there hope? Is there something one can do?
Oh, sure. Excessive sweating, or as we know it, hyperhidrosis, is a common problem, and we do address it, and we see it in the practice. Our approach is again to get a full history and do a physical exam to make sure there is no underlying medical issues that can cause excessive sweating. And once we are sure of that, then we can offer some treatment. The most common treatment, the first treatment, would be something mild, something topical. We use a specific solution that we prescribe to the patient that they apply at night, and over a few days or a few weeks, they often do see some improvement in terms of sweating. Sometimes that may not be helpful. Then we go to other solutions. For example, there is a machine that's called ionophoresis. There's a special machine that they put these pads in salt water and with some electric current, and they put it under the arms for like half an hour or so every night, and that supposedly over time helps to decrease sweating. But recently we've had a very interesting treatment, and that's Botox. Botox is used for treatment of the excessive sweating under the arms, and it's quite effective. It lasts about 7 months. It's done in the office. You give multiple injections under the skin. It's not so painful. It's totally bearable, and people they do well for about 7 months or so. And if they want to do it again, they come back again and do it again. Especially in the summer, people have this problem. They come a little bit before, and we start the treatment, and that satisfies them. If that doesn't work, more drastic treatment is some neurosurgical procedure that's done by neurosurgeons to cut some of the nerves, and that has been over the years improved. There are more refined techniques and less risky, but that's a very last resort kind of a treatment.
Well, it looks like the Botox the Botox one, and I mean, I don't think many people know that, and again, I might be wrong, that Botox, because we think it's something in the face to make it good looking, and I'm sure it's meant for that too, but so it can somehow stop the sweating for up to 7 months. And then you go and do it again if you do a Botox shot again, right?
Right. Yes.
Wonderful.
It's a great treatment.
Yeah. What about sweating? People sweating in their feet, and they have athlete's feet, and then it's just excessive. Would Botox work there as well?
Yes. Sweating in palms and soles is also very common, and is much more common in teenage group. It does work for the palms and soles. It is a bit more sensitive in that area for the injections, but it is done for people who are interested in it. There is a risk of getting some weakness in the hand or on the feet with the Botox, because it may affect some of the nerves, but that's a minor risk, and it's not permanent. It goes away. That's also it's a good treatment for.
So it's an option for a person to try, And if he feels comfortable with it for the first chat in the first few months, he can always redo it. And otherwise, I guess he won't do it, because those type of things are social inhibitors. They're just not very comfortable. So to have solutions for that, I think is a very good thing. So let's go to a doctor and let's find out. I'm sure lots of people might want to have relief there. Dr. Ghatan?
Right, and in fact, some of the insurance companies have recognized this as a necessary treatment, and there are times we can apply to get authorizations for the patients to get Botox through their insurance, and they would cover it. Not all, but some insurances do cover Botox for treatment of excessive sweating.
Well, that's good to know. That is wonderful to know. Thanks a lot, Dr. Ghatan.